Our program is truly dedicated to the residents' professional as well as personal well-being, and that's prioritized in every way.
What I love most about this residency program is the way that from day one, you're really treated as a resident. I have a great relationship with many of the attendings already and have been able to have days where I spent the entire day in the OR, and I don't think there are many other general surgery programs that offer an experience like that.
The residents work with us doing surgical cases. They round with us.
I think something the residents are really proud of, and it shows in their technical skill, is the case volume that we have here. It's not just volume in terms of numbers, but in those numbers the residents are really involved, especially at the senior levels. They're the primary surgeon with guidance from the faculty doing very complicated cases, as well as the variety of cases that they're doing.
One of the highlights of this residency is that it prepares you to be a good clinical general surgeon. So when you graduate at 5 years, you're able to do the job.
Over the course of the 5 years, they have a well-rounded training program to prepare them when they finish to be a general surgeon or to pursue fellowship opportunities after residency.
One of the great qualities about our program is the fact that you have the opportunity to have elective month, especially toward the last couple of years of your residency. For example, I'm very interested in the field of surgical oncology, and that provided me the opportunity to visit other institutions and get more experience and exposure, which eventually helps with the fellowship application process.
In my role as GME Research Director for the surgical residents, I help guide them from the conceptualization of the project to getting that project approved, to acquiring the data, to analyzing that data, and eventually to putting it together in the form of a presentation or publication. If you come to this program, even without dedicated research time, you will be very productive.
It's a community program, and it's like very busy community program, so you get a lot of bread and butter general surgery. But in addition to that, there's a lot of vascular patients that need to be managed here. The vascular census is almost equal to the general surgery census.
The residents in our program come from across the country and international. They come from diverse ethnic backgrounds and socioeconomic backgrounds and different perspectives, and it's something that really makes our program really special.
I think one of the hidden gems of this program is that there's no fellows, and as a result, our exposure to surgical, all the different procedures, the procedures that fellows are only doing at other places. So we get really, early exposures to everything. And I think throughout the years of residency, you're able to kind of mold into what you like and what you think you can see doing in the future.
The residents often have barbecues, they have beach outings, they have boating events. They do what they can to try to maintain their mental health, and we as the attendings definitely encourage that.
One thing that really sets us apart here in our program is that resident feedback really drives change.